Hello, ladies. I am Dr. Maria Kiritsi. My patients call me Dr. K. I originally come from Greece, where I studied medicine and then decided to join a 4-year residency program in family medicine. Family medicine gave me the knowledge and the clinical exposure to holistic healthcare, along with the practice of all stages of prevention. And when I was on my 4th year of training in family medicine, I was first introduced to functional medicine by a Greek primary care physician. And I immediately fell in love with the idea of applying the latest science and research principles, not just to prevent, not just to diagnose or treat disease, but to be able to maintain the highest level of health possible. So my next challenge was US. I decided to pursue further training in the United States, a country where functional medicine is well established. And this decision practically meant a very rigorous medical exam process in order to become eligible to work overseas. But thankfully, I was accepted at the Icahn School of Medicine Mount Sinai Internal Medicine Residency Program, where I completed 2 years of training in New York, followed by a 1-year fellowship in geriatrics at Albert Einstein Montefiore University Hospital in New York as well. During this time, my study on the physiology of aging while treating older patients was constantly reminding me of the critical role of functional medicine. So after geriatrics, I studied functional medicine, and then I became a functional medicine doctor. And as a functional medicine doctor, my stepwise approach to anti-aging practice is holistic and also targets the factors that lead to cumulative structural and physiological alterations that happen over time. And for this purpose, I use two main groups of agents, bioidentical hormones and peptides. Both these agents ensure this inside-out regeneration, and I truly love using them because I love seeing these time-reversing effects on my patients. So I'm going to tell you a few words about these two agents. First of all, bioidentical hormones. So hormones, you all know, are the chemical messenger system that controls every vital function of our body. And hormonal imbalances can lead to disease, and they can occur at any age. But there's one thing that we know for sure. Declining hormonal levels correlate with aging. That's why hormone replacement is one of the cornerstones of anti-aging practice. So we can use bioidentical hormones for replacement. But before going there, I want to tell you that one very important hormone in this game is growth hormone. As we age, growth hormone secretion declines, as well as the sex hormone production, which gradually declines for women during menopause and men during andropause. And we see the effects of these hormonal changes on our bodies. We lose muscle, we gain fat, we lose bone, our hair and skin does not look the same. Our sexual desire also gradually decreases. Our stamina decreases. We may experience mood disorders like anxiety and depression. And we may also experience memory problems. So all these changes that are mentioned are not truly age-related. It's not about the number, but they are indicative of this growth hormone secretion decline that happens over time. So as I told you, we use bioidentical hormones for replacement treatment. What are bioidentical hormones? Bioidentical hormones are plant-derived natural hormones that are biologically identical and exact to the hormones our body naturally produces. That's why using them does not implicate the risk of side effects that synthetic hormones can potentially provoke. So we can use bioidentical hormones, and our goal is one, we replace and restore hormones that decrease as we age to optimum youthful levels. And optimum levels are those of young adults in their mid-20s and early 30s. And luckily, functional medicine gives us the most precise and whole suite of hormonal tests, giving us doctors a visual result of the hormonal pathways rather than assigning good or bad levels in isolation. And this is how we are able to replace hormones at doses tailored to each individual patient and create an anti-aging hormone replacement plan that can optimize you inside out. And the second group of agents I mentioned before is peptides. I don't know if you have heard of peptides, but it is one of the hottest topics in the medical community right now, representing the cutting edge of anti-aging medicine. And they also represent the culmination of decades of research. And I'm telling you that because one of the most known peptides out there is insulin, which is a hormonal peptide, and it's out in the market since 1960s. And there are many different categories of peptides. So what is a peptide? Peptides are clusters of amino acids, which are the building blocks of proteins. So you can think of them as tiny, small proteins. And what's their role? Their role is to communicate with the body at the level of the cell, to signal the cell to heal or to produce energy or to increase its lifespan. So they are signaling molecules, and they are natural signaling molecules. Our body has thousands of peptides that signal the cells to perform their functions. But as we age, our peptide production substantially slows down. And also the peptides we do produce may not function as well the older we get. But thankfully, peptide supplementation is available and can help us reverse the hands of time. So we have the anti-aging peptides, and we have many other categories of peptides. A very known category of peptides in the anti-aging practice are the growth hormone releasers. They are peptides that induce the production of growth hormone, which, as I told you before, its secretion declines over time, and we can achieve optimal growth hormone levels and sustain a more youthful anatomy and physiology. But there are other categories of peptides as well. They can help us treat health declines that are associated with aging and disease. There are peptides that can decrease and control inflammation. Other peptides that are used for immune modulation, they are very good in treating autoimmune diseases. There are peptides for weight management, other peptides that may be used to increase stamina, to improve libido. There are peptides that are used for muscle and joint repair. Other peptides are used for the treatment of insomnia, anxiety, depression, or to boost mental clarity and memory. But I want to mention here that peptides are used in many European countries, including Greece, Italy, Switzerland, but right now they're not approved for use here in the UK, not yet, but we're expecting them very soon to be used. And in the US, there are more than 80 peptides that are FDA approved, and hundreds of them are in preclinical and clinical stages. So that's a very revolutionary field. So you can all understand that peptides are the absolute game changer in anti-aging medicine and health optimization. Thank you.